Hello and welcome to Caldwell County Today. I'm Paige Counts, Public Information Officer for Caldwell County. Joining me today, I have Brittainy Bonn and Chuck Crisp from Caldwell Hospice and Palliative Care. Welcome.
Thank you for having us. We appreciate you.
Today we're going to talk about something that is very important. It's kind of the basics of hospice. It's how to make a referral. So I'm going to ask Chuck because he's the admissions and referral coordinator.
Yeah.
I got that right. Wow. How does someone make a referral to hospice?
Sure. And Paige, a referral can come from anywhere, any person. Referral sources have a lot of places that they can come from. It can be the patient themselves. It could be a family member. It could be a caregiver. It could be the primary physician that cares for the patient. It could be a hospital, a nursing home, an assisted living facility, a healthcare agency. So anybody can make a referral to hospice or palliative care services. We do always encourage to have a conversation with your primary care physician if you can. If you're not able to do that and you're in need of services, or if you need education and information, we encourage people to call at any point at any time.
I'm just going to go ahead and ask right now. I'll probably ask you again this later. What number do people call to make a referral?
Sure. Our number at Caldwell Hospice and Palliative Care is 828-754-0101.
And they just tell the person that answers the phone, I would like to make a referral?
I would like to make a referral. I would like to have information about your services. And majority of those calls get sent to the referral center where we can ask questions to help try to identify the need. And we are always going to provide somebody with a need of services, whether it is hospice or it's palliative care, or if those two services don't fit the need, we try to reach out to the community resources to help that person with whatever the need is.
So how does someone become eligible for hospice?
Okay. Hospice eligibility is based on a 6-month criteria of disease progression. So an individual that would be eligible for hospice would have a life-limiting illness of 6 months or less if the disease continued its natural progression. Now, that 6 months is not hard and fast. Some folks do pass on earlier than 6 months, but many go past that 6-month period. As long as they maintain Medicare eligibility criteria and the care for hospice, then they can continue under our services.
What's included in hospice services?
With hospice services, it is a variety of interdisciplinary team members. You have a dedicated hospice nurse that will come out on different frequencies to visit weekly depending on the need. You also have a medical social worker who is involved in helping with advanced directives, with support services, with any financial consultative needs, where that medical social worker is geared towards a hospice social work need. We also have the option of chaplain services. We have certified nursing assistants who can come out up to 5 days a week, Monday through Friday, depending on the need. We also have volunteer services, and then we also have bereavement services that are available after the time of service is completed.
So it's really a whole scope of service. It's more than about health care. It's about caring for the whole person.
It is, and like I said before, it's very interdisciplinary. It is very much a team effort in hospice. We really work hard on our collaboration from team member to team member, and not only within our hospice team members do we want to have good collaboration, but also with our partners in the community, such as our long-term health care, assisted living, our primary care providers, and the physician's offices. We try to incorporate all of those entities into that team effort to provide the best care that we can for that patient and family.
You've talked a lot about hospice care. Now, what is palliative care?
Palliative care is a little different service in itself. It is a consultative service where a patient may not have a life-limiting illness. Now, they could and still be seeking, let's say, aggressive treatment like chemotherapy at the time. Or they just have a chronic illness like a COPD, a chronic obstructive pulmonary disease, or congestive heart failure, but they're not quite eligible for hospice services at the time. So palliative care offers another layer of services through one of our nurse practitioners or even through our hospice physicians, where we are going into the home, into the hospital if we need to, into assisted livings, into nursing homes, and we're helping provide that extra layer of symptom management, goals of care, helping with things like advanced directives, which is sometimes difficult to have a conversation with primary care physicians. You got so many patients coming through, it's limited time, so those conversations are difficult to have. That is where we can specialize in those services in addition to what the primary care and even specialist physicians are already doing.
Right, and once someone calls you, what happens? If I make the call, what happens next?
So if you just call and say, hey, I want to know what you do, or what you offer?
I think I might be eligible for hospice. What happens?
What we do is if you call, we want to first start obtaining information about your background and what is going on. And immediately we're trying to assess what the need is. But what we want to do is we want to set up a visit wherever you may be as soon as possible so that we can assess and evaluate for the program that would best fit you for your situation at that time. So from the initial call, we're educating, we're obtaining information so that we can get you information and a service as quickly as possible, because obviously if you're calling us, you have a need, and we want to address that need as quickly as possible.
And Brittainy, I haven't forgotten that you're sitting over here. So I'm going to ask you, making that call to hospice, it's a difficult call for people.
It can be.
Why is it important to make that call?
Well, what we're hearing from our partners in the community, from the families who are reaching out to us, especially right now during the COVID pandemic, people are a little more hesitant to access and to access their health care options, to go and see their primary physician. People are a little nervous to be out and about where other sick people may be. So we're finding that a lot of the patients that we're serving right now are in crisis by the time that they reach out to us, or by the time that they've went to see their physician and their physician is like, oh, let's get you connected with some additional support in the home. So what I would say to someone who's wondering, should I reach out and should I get more information and should I approach these services, you're going to have additional support in your home. You're going to have somebody who can come in and reassure you that either you're doing everything you can for yourself if you're the patient, or if you're that caregiver. Because really, when you think about hospice, we're not just talking about the patient. We're talking about the patient and the family as our unit of care. And so you're going to have someone who can come out and, not only reassure you that you're doing the right thing, answer your questions, but can also educate you if you don't know how to give a bed bath and you would like to learn how to do that for your loved one. Our team can help you do that. If you're having financial trouble and you're worried about keeping your lights on, our social worker can help you access resources to make sure that your bills are paid. If you have questions about medication and you just don't know what to do next, you have a nurse who can come in and help you arrange your pill box for the next 2 weeks and keep everything ready to go. If you're having issues with symptom management and if you're uncomfortable in your home, you have these providers who can come into the home, can get you comfortable. If your goal is to stay home, that's our goal too. And we'll do everything we can to make you comfortable, to give you what you need, to stay home, to enjoy the time that you have with your family. So I would say, take advantage of that support and that care. I know we were talking earlier, about the number of patients that we're serving right now for a very short period of time, just simply because people, of the pandemic, and that people are concerned and don't go out and don't access this care until it's a desperate need. But there are so many more things that our team can do to educate, to promote comfort, to to help our patients have a good quality of life, and in some cases to actually live longer and be able to enjoy that time with their families, that we encourage folks to reach out. I know it's a hard step to take, but there's a lot of benefit to that.
Yeah, and Paige, just expanding on what Brittainy was saying, some more of the benefits. With hospice services, patients are accessible to any piece of durable medical equipment they needed. So if they needed a hospital bed, if they needed oxygen, a wheelchair, a walker, a bath chair, lift chair, I could go on and on with a large list. Those are all provided through hospice services. Also, medications that are related to the hospice diagnosis and symptom management are paid through the Hospice Medicare Benefit. So those are also covered. And then you have the benefit of after hours, you can pick up the phone if there's any needs at any point in time, day or night, weekends, any time of the year, and you can call an on-call nurse, an on-call social worker, and we have a physician on call. So there's a great sense of relief many times for patients and caregivers knowing that they have that ability to pick up the phone at any time and get care for their loved ones. Somebody could come out and visit in a time of crisis. Also, we have 2 patient care units, one in Lenoir and one in Hudson. During the current pandemic time right now, there's been a little change with our patient care units. Our current Lenoir, which is the Stevens patient care unit, has been upfitted to provide care for COVID positive patients. So any hospice individual that needs hospice care and is COVID positive, we bring them to that unit. The non-COVID patients currently are being cared for in our Hudson or our 4 Lines patient care unit. And different levels of care with those patient care units. We do have patients that more often than not come in for what's called general inpatient care, or we're managing symptoms, whether that's pain, nausea and vomiting, maybe respiratory distress, maybe agitation, as opposed to going to the ER. You're coming into the hospice patient care unit, we're managing those symptoms, and then many times our patients may return from where they came, if that's back home, once their symptoms are managed. We also have respite care, meaning that a patient can come in for up to 5 days, every 30 days, if we have beds available, to give that family and caregiver a break and some relief.
And you guys hit on so many things, and so many questions popped into my head. I'm going to see if I can go back through and think of everything. Some of the things you said really address the hospice myths. There's a lot of just things people get wrong about hospice. One of them that I thought of while you were talking about your patient care units is that all hospice patients are cared for in one of your 2 patient care units. And that's not true.
No, that is not true. We care for patients in many settings. That can be in the patient's home. It could be in a hospital. We care for many patients in the hospital. It could be in an assisted living facility, a nursing facility. Any place I'm leaving out, Brittainy?
No, I don't think so. I think anywhere a person calls home,
Yeah.
we will go.
Yeah, we've met many needs in different places. I know years ago when I was in home care myself, I made patient visits to McDonald's and met patients to, that's where they wanted to meet. And so I know that there's just about anywhere where we go to meet a patient's need.
And also another thing that you've already answered this, but a lot of times people think hospice care means giving up, means there's no hope. And you both have said things to indicate that again is not true.
Right. We don't see enrolling as hospice as giving up. We look at enrolling as hospice as embracing almost a different view of what life is. We want our patients and families to live the fullest till their last day. Our goal is to empower those patients and families to make decisions, live as independent as possible, hopefully at home if that's where they want to be. We try our best to help them achieve those goals, and we hope that through our services that we're helping those last days be the highest quality of life that it can be, and meanwhile we're helping to provide that comfort and that need.
And we've had situations where once a patient has come under our care, their symptoms have been managed, their needs have been met, and they've actually what we call graduated from hospice because they were no longer eligible. They no longer met that 6 month or less criteria for their prognosis because they got the extra TLC and help that they needed in their home. So that happens fairly often. I mean, we were talking about we are licensed by the state of North Carolina, and Medicare also, governs the regulations that we have to follow. And if a patient doesn't meet that criteria, then it's our responsibility to discharge them and send them on to another service. So that happens sometimes too.
Yeah.
And so accepting hospice services is not giving up. And if you become too well for us to care for, then we're going to help you find the next step for you.
And
So.
often we have patients that enroll originally in our palliative care program and may transition to hospice if they have had a change in their disease progression, that they become hospice eligible. And we've had them go back into palliative care. They have gotten better through the hospice services, and they graduated, as Brittainy said, went back into palliative care. And sometimes we've had folks do that several times, go back and forth.
So that dispels the rumor that hospice is only for people who are near death.
No, hospice is not for just folks who are near death. We highly encourage, and there are studies out there that show the earlier a patient can become involved in hospice services in their prognosis, in their disease prognosis, the more quality of care, the higher quality of care they receive, and often they live a longer, fuller life because of the services they're receiving. So we do encourage our physicians, patients in the community, families, make that referral as early as possible. Let us get involved and help you as early as possible.
We've talked a lot about the patient. How does hospice care impact the caregiver?
Well, a lot of what our team does is to go in and provide education, support, to ask that patient what's most important to you today. Is it to be pain-free? Is it to, plan your last vacation? Is it to, is it to see a family member that you've not seen in a while? And then also to ask that family member what's most important to you. How can we support you in your task of caregiving? And being a resource to our families is extremely important, and it's a huge part of the task that our team has when they go out to support one of our patients.
We provide tools through our patient caregiver guide that we provide at the beginning of services, which has some really good information related to symptom management. And we actually have a section in there called a caregiver guide, and it's common tips to caregiving. So if a patient was having some nausea, for instance, you could look in that section related to nausea, and it talks about like giving ice chips for the patient to suck on to help relieve the nausea. So what we're trying to do is empower that patient, that family, that caregiver, but we're always there if you need us. But we're certainly empowering them with tools to help provide the care. And then we mentioned it earlier, for the caregiver, for the family, once services end and that loved one has passed away, we don't just leave you. We do have bereavement services that we want to help you through that period of time after your loved one has passed.
So is hospice care expensive?
It is not. Basically what we want our community to know is that we are a not-for-profit organization, and we are going to care for our patients and their families regardless of their ability to pay. The majority, I would say, of our patients qualify for the Hospice Medicare Benefit, which covers the cost. And it's a benefit that's there for you, that you've paid into with your tax dollars. It's there to ensure that you have this level of care when you're eligible for it. Hospice care also accepts most insurances, TRICARE, all these different resources that are available to us to pay for our health care. But again, we're never going to deny service to a patient who has a need.
Yeah, the Medicare benefit consists of Medicare, Medicaid, VA insurance, TRICARE, and then, as Brittainy mentioned, most private insurance companies like Blue Cross Blue Shield, Aetna, United Healthcare all carry a hospice benefit to the insurance. But once again, like Brittainy also said, we're not going to deny anybody of services, no matter of their ability to pay or financial status. Our community has been very good to us as an organization. They have really over the years contributed to provide us with the resources to turn around and provide resources to others who do not have the ability to pay.
And as you have dealt with the COVID pandemic, tell me how that has impacted your work, the way you care for your patients.
Well, I think COVID has thrown everybody for a loop, but I can say I'm really proud of our leadership at Caldwell Hospice. Since the very beginning of the pandemic, we have had an emergency response team that has been on top of the changes and information from the CDC, the changes in regulations with Medicare, all of the guidance that's available to us to make sure that we're keeping our staff and our patients safe. So we have implemented all the guidelines based on the guidance from the CDC and from Medicare. Our staff goes out wearing appropriate personal protective equipment. We socially distance and have changed the way that we work in the office in order to keep each of us safe. So that way there will always be enough staff members to make sure our patients' needs are met. And then, as Chuck said earlier, we've upfit our patient care unit to serve patients who are COVID positive, and to make sure that their families have access to see them. And so we've really taken a lot of steps to make sure that everybody stays safe. And I don't know if there's any other good points that I've missed.
Yeah,
Chuck,
I think you covered a lot of good points, Brittainy. And we're still seeing patients, even though they may be COVID positive. We are still going into the hospital. I know the admissions team will go just about anywhere there's a need.
Well, no, there's one other thing I forgot to mention. If patients are concerned about having someone come into their home,
yes.
Or if we're serving a patient who's at a long-term care facility that is dealing with an outbreak and they're trying to limit the number of people coming in, we are able to offer telemedicine visits, yep. Which has been wonderful to assuage people's concerns, to make sure that those patients, even if they're not comfortable with somebody coming in, that their needs are met, that they have answers to their questions, they have their medications are there appropriate and are meeting their needs, and that they have everything, and just without the human touch. But I will say that the majority of our patients have been comfortable with us coming in. Yeah. And like I said, our team has taken great pains and followed every appropriate procedure to keep everybody safe, so we can keep providing that care.
And something else that we've done to add to Brittany's thoughts. With patients who have been in facilities, family members have not been able to see them for many, many months at a time. So when they come under hospice services, our team is able to go in and see the patient, and through the telehealth type of visit, we utilize either the phone or the computer and do a FaceTime visit while the family is able to, through their computer or phone, see the patient. Patient can talk back to them, family can talk to them. So our staff has been coordinating those type visits when they're in there to help the family to be able to see the patient, and vice versa. Yeah.
And I'm going to tell you a story.
Okay.
I'm going to try not to cry. We one of our teams was serving a patient at one of our local skilled nursing centers, and the patient was in the facility. Her family wasn't able to be there. Her husband of 60 plus years was immunocompromised and was not able to come in and have that last visit with her because it was just not safe. So our team, one team member was with the family, one team member was with the patient, and they facilitated this visit, and he got to see her and talk to her and tell her all of the wonderful and loving things that he wanted to tell her. And he got to have that closure. She got to have that presence, and she passed shortly after that And it was just, I mean, our team was so honored and felt so blessed to have been able to provide that moment for that family. And we were so grateful to be a part of that. And then to to the skilled nursing center, because their staff was so busy caring for everybody else. We were so grateful that they let us help be their hands and hearts in there as well. So it was really special.
I think what hospice does, the privilege of being with a patient during their final months, weeks, days, is amazing. And you do it so well. I do have one last question, but I have two more questions.
Okay.
Is there anything I've forgotten that you wanted to talk about?
I don't think so. We just want to encourage folks, if your loved one if you're seeing a decline in your loved one, or if you yourself are experiencing a decline and you're having trouble meeting your needs at home, you're having symptoms that need to be managed, you need some support and care in the home, don't hesitate to call us. If you are not yet eligible for hospice care, we can get you in touch with one of our nurse practitioners in our palliative care program, and you can get that extra support, at least once a month. And part of that includes connecting you to other resources. So if you are eligible for home health, our nurse practitioners can order that service. If you need durable medical equipment, our nurse practitioners in palliative care can order that service as well. And they have lots of connections to other community resources. And then if you are eligible for hospice, you have that whole team that's there at your disposal 24 hours a day to help meet those needs in your home.
Yeah, we want folks to call. If you're not sure, just give us a call. We'll provide education, and we will certainly come out and provide an evaluation. And we'll reach out to your primary care provider. If you haven't had a chance to talk to them, you're not sure what to do, give us a call. We'll coordinate, and we will always come out and evaluate and assess the need. So we don't want people to wait or be hesitant not to call if they don't have a chance to talk to a physician. Go ahead and make that call. We'll help you with the process.
And Chuck, what's that phone number?
It is 828-754-0101.
And you guys may have already answered this with what you said, but I'm going to ask anyway. Both of you have years of hospice experience. When people see you, they know who you are and where you work, and they ask, and they say, "Isn't it sad working at hospice?" How do you answer that question?
Well, I'll go first. I don't find it sad, and I always tell people this. I don't necessarily work in a patient care setting, but I have done some of that in the past, and my most rewarding experiences as a staff member at Caldwell Hospice and Palliative Care have been the opportunities that I've had to be with a family when their loved one is leaving this world, and to be the extra set of eyes and ears who hasn't heard that family's stories, so they have a reason to tell their stories. That was one of my favorite experiences, actually. It was with a family whose loved one had been removed from a ventilator, and I was a new person there, and I just asked some questions and got them talking, and this family was an absolute hoot. And they realized that whenever they were telling one of their funny stories and they were laughing, that their loved one who had been removed from the ventilator's heart rate would increase. And that was an indication to them that he could still hear them. And that man got to leave this world listening to his family tell their favorite stories about him. And I will never let go of that experience. And whenever anybody asks me, "Isn't that sad? Isn't it hard to work at hospice?" No, because what we do gives people comfort and the support that they need during those last minutes, and it's so special.
Yeah, hospice is it's a calling. You know when you come to hospice if it's right for you right away, or if it's not, and that's okay. But for me, it was the right fit, and I've been there a little over 10 years now, and after taking care of patients and families telling me oh, thank you so much. You were such a blessing to us through this whole process. And then I look back many times and I wasn't, I was the one receiving the gift. That, they thought that I did so much for them, but oftentimes it was me who was being blessed by what was, the process and providing that care. This is the toughest time in a person's life and a family's life. This is the hardest time. And to be able to help someone through that process and get them to the next step is very rewarding to me, as a nurse and as a person.
Well, thank you both for what you do. And I encourage you that if you think you or your loved one may be eligible for hospice, reach out. Don't wait until the last minute, just reach out. Thank you both for joining me today, and thank you for watching Caldwell County Today.